Hey there, so I'm getting ready for the day right now, but I wanted to answer this question because I think this is a really important thing to know. When it comes to your amniotic fluid or your water breaking, you need to know something called COAT, C-O-A-T. Can't talk. The color, the odor, the amount, and the timing. Now, I want to say right now that if your water breaks, you do not have to rush to the hospital. This is something that I teach my students inside of both of my birth classes, Calm Labor, Confident Birth, or the VBAC Lab. You do not have to rush to the hospital if everything's fine. You don't even have to rush if you're GBS positive. I know I'm gonna get a lot of slack on this probably, but that's okay. I can handle it. I have some rules for you if you're GBS positive as well. However, if your water breaks, you want to note the color, the odor, the amount, and the time. So if it broke at 8 a.m., you want to write down 8 a.m. today or 8 a.m. the date. You're going to look at the color. Normal amniotic fluid should be clearish with a little pinkish tint, but it should be predominantly clear. It may have some blood streaked in there. However, if it has greenish yuck, brownish yuck, or it's predominantly bloody, then that's a different story. You're going to need to go in and get checked. If it's predominantly blood, I want you to call your doctor on the way. If it's greenish, yuckish, call your doctor. They're going to send you in. You want to have the odor. The odor should not be, it's got a very distinct odor. And in fact, when I was pregnant, I could smell it a mile away. So if you came into triage to see if your water is broken, I'd be like, her water's broken. No, that's urine. Anywho, it has a smell. If you smell a rancid, terrible smell, then there's a chance that you have an infection. Go in. You want to note the amount. Is it a ton or is it a trickle? Remember, when your water breaks, it's not like in the movies where they're like, oh, and it's all of that. Just like the video I posted of the mama who showed hers, you just see a little puddle on the ground, and sometimes you might just see a trickle. You can have a high leak, a low leak, a gush, a trickle. So remember, COAT, COAT.